A few weeks ago, Peter Marks, who's the head of CBER, which oversees the regenerative therapies through the FDA, uh, in a talk said bone marrow stem cells are not homologous and they're also more than minimally manipulated. What that means is we cannot use bone marrow stem cells to treat our spine and joint patients. But if you look at the FDA guidance, we feel that bone marrow is compliant. And I got in touch with Dr. Manchikanti, and he sprung into action. He really believes that this is an awesome therapy for patients, and he wants them to continue to have access. Because I've been doing interventional pain for about 25 years and started doing stem cell therapy about 4 years ago. When I compare to the procedures that I do, the traditional approach versus stem cells, there's a huge difference. You see patients getting significant pain relief and it lasting for years, and very rare complications, which is so different from what we generally do in traditional medicine. Getting people off the opioids is another advantage. So we felt it was very important that physicians to be able to continue providing these therapies to patients, especially in chronic pain. And these are the patients who have been suffering for pain for many years. MRIs have severe changes, seen multiple doctors, had multiple procedures. And these are the patients that we're helping with stem cell therapy. There's no question in my mind, it is the future of pain medicine. So when you see the FDA coming out and saying statements like this, it is scary, because the last thing you want to do is them shutting you down from offering these procedures. So Dr. Manchikanti and the ASIP leadership wrote a very extensive and very nice letter to the FDA, making our case that bone marrow is FDA compliant per their guidance, and we need some clarity on this issue. And because of his connections, Congressman Fred Upton, he's also backing this letter. He was the ex-chairman of the Energy and Commerce Committee, which oversees the FDA, and is also one of the architects for the 21st Century Cures Act, which gives the patients the right to try new treatments. So with that, we're hoping that we would be able to continue providing care to these patients. And that's what I'll be talking about today, how based on the FDA guidelines that we are compliant when we use bone marrow. And I see where FDA is coming from. If you look at the stem cell clinics, a vast majority of them are shady clinics or scam stem cell clinics who are taking advantage of desperate and vulnerable patients. And in 2015, there were about 500 of these stem cell clinics in the US. And by 2019, it tripled to almost 1,200. So, and there have been complications, but all these complications are not from stem cells, but because they have been done by the wrong people. By that I mean not properly trained or qualified, and injecting them in the wrong places. And there were a lot of infectious complications that was manufacturing issue, not paying attention to the sterility of the product. But if done by physicians within their scope of practice and they're well trained and qualified, it's very safe and very effective. And if you look at the number of stem cell procedures being done in the US, majority of them are, if you look at the numbers, majority are being done by these fake or the sham clinics, as I would like to call them. And there are many telltale signs. First thing is if they're advertising heavily. A lot of them have seminars. It's a sales pitch, like a old car salesman. They push you to get the procedure. You have to sign right then and there. We give you 30% off. So there's the pressure, the sales pressure. Secondly, that clinic is not owned by a physician. It's owned usually by a chiropractor, and that's a vast majority of the cases, or a business entity whose primary goal is not the patient's well-being, but their financial well-being. So they're more interested in money as opposed to taking care of patients. And the person performing the procedure is usually a nurse practitioner or a physician who's not trained or qualified to do these procedures. And they do not use stem cells, they use amniotic or umbilical cord products because it's off the shelf. They don't have to do the bone marrow harvesting that the real stem cell therapy needs, because that takes expertise. There are many ways to tell, and if someone is pushing you to get it done, just stay away. It's not, the problem is patients don't know about this. There needs to be an awareness among patients who's a legit clinic and who's not, and it's not difficult to tell once they have this information. And the other thing is they charge a lot. You're talking about I don't know, $10,000 to $15,000 for like a half an hour procedure. I still remember, I'll never forget this, I got a call from a lady in California, and so she found us on website, and she went to one of these clinics and attended a seminar. Her husband is a firefighter, elderly gentleman, maybe in his 70s, ex-firefighter, having knee problems. And so they x-rayed his shoulders, his elbows, his hips. You know, elderly population, you're gonna find everybody has arthritis. They don't have pain, but they do have arthritis. And they said we have to inject all these joints, otherwise he's gonna get worse. And she had a sticker shock when it came to $25,000. And then that's when she knew there's something off here. She called me. So you keep hearing stories like that, how, I mean, why would you scam a retired firefighter? I mean, how low can you get? I mean, there are a lot of, these clinics have a lot of family practitioners and internal medicine docs. In fact, there was a study in JAMA that 58% of these procedures were done by legit specialties like orthopedics, PM&R, or anesthesia pain. Who are the rest 42%? And that was the family practitioners and internal medicine docs and other specialties. Only 66% were physicians. The rest, 34% were done by nurse practitioners and physician assistants and naturopaths. So it's scary if you look at these numbers. How many unqualified people are doing these procedures? And that's where all the complications are coming from. So they're clubbing legitimate clinics with the illegitimate clinics, and they're not differentiating. And they should. That's FDA's job, is to separate the wheat from the chaff and not throw the baby with the bathwater. That's what they should be doing. And that's what ACIP is trying to work with the FDA to do that. And hopefully this letter will throw some light in that direction. I do see where FDA is coming from. Their job is to protect patients from getting scammed and harmed. But at the same time, they should not deny these patients from getting legitimate care. And that's FDA's job, and they should do it. And it can be done. It's not difficult. In fact, FDA sent 400 warning letters, unprecedented in any field of medicine, to send so many warning letters to different physicians and companies doing this, perpetuating this scam. So I think they're trying to do their job, but they're clearly short-staffed to stop it. And even though they did that, I don't think it made a big dent. But I don't know what's going to happen now, because from June 1st of this year, the discretionary period is over. So all the, I know few companies have stopped selling these perinatal products. So maybe that will help some. There are so many studies showing that stem cell therapy is safe and is very effective. I'm just going to briefly present those landmark studies. There is one study where by Dr. Petin, who's an orthopedic surgeon in Colorado. He took 26 patients who were supposed to get fusion, and instead of fusing them, he injected stem cells into their disc, bone marrow stem cells. A year later, almost 80% of them could avoid fusion. And he followed these patients for 5 years. And even after 5 years, patients who responded, the pain did not come back. I mean, that's huge. Comparing stem cells to fusion, think about the expense and think about the complications. And fusion surgery, if you look at the data, it's notoriously poor, right, in terms of results. So, and then there is amazing data from Dr. Hernigo, who's an orthopedic surgeon from France, who's like the godfather of bone marrow stem cell therapy. And in one study, he compared total knee replacement with stem cell therapy. What he found was there were far fewer complications in stem cell therapy, and the patient satisfaction was much higher with the stem cell therapy. And even after 12 years, patients continued to have relief. In another study, what is done is he looked at patients who were supposed to get knee replacement and see if stem cell therapy can avoid it. And he injected subchondral bone marrow stem cells. And he evaluated the patients 15 years later. Still, the pain did not come back. And he could avoid knee replacements in those patients. And then slightly off topic, but it's very relevant, is in March of last year, Dr. Manchikanti and I and Dr. Hirsch, three of us published a paper. That's the first paper in the US. We were talking about the role of stem cell therapy to treat COVID patients. And the second paper in the world, actually. And asking the FDA to give compassionate use authorization. FDA did give, it was very proactive during that time. And I'm not saying it's because of our article, but it did. And now we have 7 controlled trials, 7, and totaling about 150 patients, showing that patients who did not respond to conventional or treatments, they responded well to stem cell therapy. The mortality rates decreased. X-ray and CT changes cleared up. Inflammatory markers got better. I mean, how cool is that, right? I mean, it just shows the power of stem cells and 0 complications. And then Dr. Manchikanti and I and our team, we published another paper where we evaluated stem cells which were used to treat organ failure by using IV stem cells. and most studies showed positive results. And can you guess the number of complications from stem cells per se? In over 200 studies, we evaluated 200 studies, 0. Again, telling us how safe this is. It's a testament to the safety. Cell is so complicated and so powerful. Like humans have made so many advances in science, but as of today, we still can't create a cell. It is so complex, and we are just harnessing the power of nature to heal and repair. I mean, what can be better than that?